Hello, everyone. My name is Harjeet Gorman, and today I will be presenting my internship with the South Asian Heart Center that was sponsored through the Western Regional Public Health Training Center. Today, I'll be sharing the objectives of my project, my methodology, results, and the conclusions. So to share a little bit about the South Asian Heart Center, this is a nonprofit organization founded in 2006, and they are working to address the twin epidemics of both diabetes and obesity in the South Asian community. They do provide services to people of all backgrounds. However, they do have specialized care and recommendations for those who are South Asian. And they provide students with the opportunity to intern with them as a heart health coach and to educate the community about healthy lifestyle factors, along with conducting their yearly checkups. So this is where I came in and I was able to be trained as a heart health coach. And lastly, they have a program, one of their programs, the Aim to Prevent program, which is one of their main lifestyle management programs offered to their participants. So quickly, why does this matter? Type 2 diabetes is on the rise worldwide and it affects people of all socioeconomic backgrounds. In 2019, the ninth cause of death worldwide was diabetes, and 1.5 million people died from it. Diabetes can also cause kidney failure, blindness, heart attacks, and strokes. And research has shown that South Asians are more prone to developing diabetes and have a greater risk. So this is, where unhealthy diet, lack of physical exercise, excess hepatic fat, and abdominal obesity come in, which is something that South Asians are specifically dealing with. So the objectives of my project: 1, educate myself; 2, connect with participants; and 3, reach the Punjabi community. So throughout this process, I gained a clinical understanding of why lifestyle matters. I learned about motivational interviewing. I also had an opportunity to connect with people during the pandemic to check on them and to work towards preventing obesity and diabetes from increasing. And I also had the opportunity to try to use my expertise in Punjabi to provide services to this specific community. So my education and training officially started in August of 2020, and I finished my internship in November 2021. As a heart health coach, I was trained for 2 to 3 weeks on clinical knowledge, and I also learned about different types of blood tests, clinical terminology, and what exactly diabetes is. I learned how to navigate and use an online EMR system. I learned about motivational interviewing techniques, lifestyle recommendations based on meditation, exercise, diet, and sleep, customer service skills, making secure phone calls and sending secure emails, transporting laboratory reports to the online EMR system, and so much more. I spent approximately 6 to 8 hours, 5 days a week for about 3 weeks for my training, learning all of this new information. And I conducted mock calls, practiced delivering the information to participants. And after finishing this extensive training, I was ready to take my calls independently. So when I connected with participants, I spoke to them for their yearly annual checkup phone appointments, which lasted approximately 40 minutes. And I discussed their medical history, their medications, meditation, exercise, diet, and sleep. Some of the recommendations I would make as a heart health coach was exercising at least 150 minutes per week, following the plate method, and sleeping around 7 to 8 hours per week. To help with funding for the center, I participated in their telethon during Thanksgiving of 2020. And I called the center's participants and explained to them what the funding was needed for, and also helped to collect those online donations. In terms of reaching out to the Punjabi community, I worked with the center staff to determine ways we could reach out. So I prepared and gave a presentation to a lodge clinic in Sacramento to share details about the services that the center provides. I also reached out to Shifa Clinic in Sacramento to educate their staff about the center so that patients could be referred to them if needed. I translated flyers in Punjabi on Meds, which is one of the lifestyle platforms that the center uses, so that Punjabi participants could, be able to use those. And as a coach, I called prior Punjabi participants to speak with them in Punjabi for their phone appointments, which before no one was able to do at the center. So the results of my project: during my time, I conducted a total of 256 phone appointments with participants of the center. Out of the 256 40-minute appointments, 2 were with Punjabi participants, and I actually had a lot of difficulty connecting with the Punjabi participants since their contact information was no longer applicable, or they really did not engage back with me in my emails. So that was one of my hurdles in completing that objective. I called a total of 190 participants for the telethon, out of which 6 participants donated to the center, contributing $425. Several participants who I spoke with found the annual checkups actually to be very helpful since they reminded them to follow small changes like moving more or simply just eating 12 nuts daily. Some participants emailed me after a few months to share that they were spending more time exercising or following the plate method, which was really awesome to see that the work we were doing was making an impact. Then I noticed that some participants who the center didn't speak for many years were actually willing to do an annual checkup. And possibly this could be because of the pandemic and people concerned about how their lifestyle had changed. Conclusion. So the South Asian Heart Center was able to reach a wide range of people from the South Asian community, even during the pandemic. In order to better connect with the Punjabi speaking participants, the center could visit 6 temples to talk with the community in person. Since there were difficulties connecting with them on the phone or via email, like I had mentioned, it might be easier to talk to them in person and actually reach this community. Due to the disruption in lifestyle from the pandemic, discussing changes participants could make to their lifestyle while living at home was well received. So discussing how people could use a standing desk or, moving out while they're doing meetings over the phone. And diabetes can be prevented through lifestyle interventions like exercise and diet. So the work that the center is doing has been successful for many participants to improve their diabetes, to lose weight, and providing culturally appropriate resources to individuals makes it a lot easier for those folks to adapt new lifestyle changes in their health. So one of the things that makes the center unique is that everything is culturally appropriate and relative, and that encourages participants to make those changes. Finally, more health organizations are needed to provide cultural care to patients of all sorts of backgrounds and cultures. I would like to acknowledge the South Asian Heart Center for their dedication, time, and training me to become a heart health coach. This was a very, very nice opportunity for me to learn all of this clinical knowledge and understanding. And I feel I truly gained a lot as a coach, as an intern in this process. I would like to thank Ashish Mathur for allowing us to expand our services to the Punjabi community. I would also like to thank Anita Sate and Prajakta Wenganekar for training and supporting me. Thank you to the Western Regional Public Health Center for supporting me in my project, and to Abigail Soka for all of her time and support throughout this process. Lastly, thank you to my family for being there for me during my internship. And thank you all for listening today to me and my presentation and everything that my internship was about. Thank you.